Hey guys, it is Luke, the documentary here, reporting in on April 26th of 2025. It's now been 2 full months since I had major surgery to hopefully cure my sleep apnea. I'll give a detailed update on how I'm doing now. Before I dive into that, I'm going to quickly go over what my case was like in case it was similar to yours and what exactly I had done. So I'm a 24-year-old young man out of the United States. I'm 6'5", roughly 190 pounds. Despite being relatively thin, I was diagnosed with sleep apnea a little over 2 years ago through an at-home sleep test where my AHI came up roughly 6 to 7 events per hour, obstructive events to note. That sleep test, to my knowledge, did not test for RDI, which I believe my RDI was much higher, and that explained the severity of symptoms I was experiencing. At that time, the reason I got that sleep test was because I got COVID and my health was plummeting fast. Beyond that, from a visual appearance, pre-surgery, I would say, and others who were honest, that my jaws were slightly recessed. Just from a visual perspective, not horrible, but not much of a jawline, and despite being skinny or not big, if I would smile sometimes I would have a double chin. Beyond that, my nasal breathing, which I think contributed to my sleep problems, pre-op were below average. Not the worst I knew of, but not like normal people. Often one nostril would be pretty useless, and I mainly breathed just through one. Also, I had a history of acid reflux and some swallowing difficulties. After I got the sleep test, I then got on treatment with CPAP. I then moved also to mouth guards through exercises, through breathing exercises, to bi-level and to the didgeridoo. These can work for some people, but they were not sufficient results to me and not very significant results at all, any of them. So that ultimately led me to get this surgery. What my symptoms were like pre-surgery, right? Lots of fatigue, lots of weakness, and mentally disoriented, mentally grumpy. Previously, like throughout my entire life up until this point, I would have never reported that I slept very well, even as a child. As a child, I remember almost entirely dreaming in nightmares, which I think was indicative of me having breathing issues while sleeping. And up until surgery, that pattern of nightmares continued. So what did I have done? I had double jaw surgery with Dr. Alfie out of Houston, Texas. The surgery is otherwise known as maxillomandibular advancement surgery. That is where my top jaw was moved forward 9 millimeters, my bottom jaw 10. I was also moved up, or I believe that's called downgrafting, 1 millimeter with counterclockwise rotation of roughly 6%. Dr. Alfie also performed some nasal bone shaving to hopefully help improve nasal breathing. And that was the treatment protocol. Pre-surgery, pre-op, I did not have any orthodontia. Also, I was never expanded both as a teen with orthodontia, nor pre-surgery, say, with some kind of palatal expansion device. None of that was deemed necessary for my case, and I never had any of it done. The surgery I did get covered through my insurance off of my state marketplace, and that costed me my out-of-pocket maximum, travel costs, and a bunch of other small bills. Roughly, counting orthodontia post-surgery, my cost is $20,000 USD. So how is my sleep doing? My sleep over the past 2 weeks has been improving. About 2 weeks ago, I did do a video where I was having growing concern about not improving and maybe even getting worse and getting very poor sleep. Around that time, I then flew back to Texas, had my 6-week post-op appointment with Dr. Alfie, and he alleviated some of my worries and just said to continue on. He mentioned maybe I could look into treating any allergies I might have to improve my nasal breathing, which might improve my sleep as a whole. So I came home from that, maybe, slightly improved in sleep, but I think what's been turning me around recently is not only time, but treating my nasal breathing with more precision or more attention. So I've been using a saline nasal spray. I've also dug out of my closet some vitamin C, which I have used previously to work as like an antihistamine to help with previous allergies. So with a combination of vitamin C and the saline nasal spray, along with the recommendation at the 6-week post-op appointment for the nasal dilators on the outside of the nose, like the Breathe Right breathing strips, all of that has, I think, turned my case around a little bit, my recovery around a little bit. And in the past 2 weeks, maybe half of my nights have been fairly decent. So I'm not, now at the 2-month mark, it's completely normal to still be quite fatigued, not only from surgery, but from the lack of quality sleep for a long time before that. So I think I'm in a pretty decent space with that. And I do expect my sleep to continue to get better and my energy levels to continue to get better. I have some kind of additional nasal spray coming in the mail soon that I think will even further improve my nasal breathing by addressing some histamine or mast cell release. It's just like over-the-counter nasal spray I bought online. But with all of that, that's kind of where my sleep's at. What that means though is that I generally just sleep through the entire night if it's a decent night. If I sleep extra long, say more than 8 hours, I run the risk of waking up or awakenings. I'm not quite sure if they're apneas or if they're old brain patterns working, but say actually like last night I slept 12 hours, and the last hour or two I had maybe a dozen awakenings. But if I stay within the normal range, or like say the 8-hour range, my sleep now is getting pretty consistent. Do I think I'm cured? At the moment, no. I still have, maybe it's 50-50 that I have a good or bad night. And there's still things to come, still swelling to go down, and post-op appointments. And I got some further treatment that I'll disclose in a little bit. But I think I'm in it's good signs so far, and looking forward to continued improvement. In terms of swelling, most of my swelling came down. You can see in my other videos, most of it came down within 1 month. I think I just have some remaining external swelling around my nose, say like lip area, but that is not entirely indicative that there's maybe internal swelling, as my surgeon said. But that wasn't much of an issue for me, and it came down very rapidly. I'm still numb, mainly just in my gums of my teeth and below my bottom lip. I'm maybe gaining a little bit of feeling. I noticed in the shower the other day, like water hitting my chin, I could kind of tell it was happening. But numbness for sure still there, bottom lip. But I think that's at least somewhat to be expected. Pain and soreness are all pretty much gone and have been gone for a couple weeks. So my jaw feels a little bit foreign in its location, in like how my tongue and teeth work post-surgery. But pain-wise, I've been off of pain medication for maybe a month, maybe a little bit more than that. So pain's not much of an issue, swelling's not much of an issue. I'm numb, but it doesn't really affect my daily life too much, and I'm gaining a little bit of feeling back. My nasal breathing, like I mentioned, has been improving through addressing what I previously have thought of as just minor allergies, but with addressing those, I'm breathing better through my nose, and my sleep it's now at the best place it's been since surgery. My next steps, as I mentioned earlier, are to get post-op orthodontia. I have an appointment next week with 2 different orthodontists to see which one I want to go with, and hopefully just get clear liners like Invisalign on both of my top and bottom teeth, just for minor adjustments. My teeth are pretty much in a good place. I think I just want to expand the distance between my molars a tiny bit to help with tongue space, and get my teeth to connect a little bit more as they're a little bit separated now post-surgery. Both, or I should say, that treatment, or how I'm going to direct my orthodontic treatment, I'm going to hopefully navigate with my new myofunctional therapist. My surgeon recommended a specific therapist who I'm now going to be working with in 2 weeks. And so that is also the second part of my treatment plan moving forward. And that, I believe, will look like roughly 2 months of myofunctional exercises and devices to help with proper tongue posture during the day, now with my new jaws, and just strengthening and toning my airway. How am I feeling about all of this? Now at the 2-month mark, it's really all flown by. The surgical process, or say the first week of actual recovery, it all has been easier than I expected. Not super challenging. Maybe that's just because I had perhaps a very good surgeon. I did choose him for his expertise, but I haven't found the actual process too challenging. What I have found challenging is confronting my expectations on how quickly my sleep would improve and my energy levels would improve. However, the spot I'm at now, I think that I'm not in a poor spot for sleeping, or having the chance that this truly did cure my sleep apnea. As long as I give my body and brain more time to heal and process kind of my new physicality, my new jaws. To note though, I am, at least when I'm a little bit more energetic, which now I get bursts of throughout the day, I'm pretty excited and would love to have all of this in the past so I can move on with things. It would be huge. This has been a hurdle for a couple of years. And so the last thing I want to touch upon is the future of this channel and my uploads. I'm going to continue to document my journey, and I'm really committed to that. So if you subscribe, or just keep an eye out for it, keep an eye out for my videos, I'm committed to documenting this whole process and to see truly if this cured me, and if not, what my next steps are in documenting those to ultimately reach a cure, as I'm not satisfied with anything less, at least at this young age of 24. So subscribe, like this video, that helps a lot. Drop a comment on any questions you have or any feedback, but know that I'm going to continue posting for sure, and that and even sharing any tips and tricks I learned along the way, like last week where I covered how I got my jaw surgery covered by health insurance. I'm now thinking of offering a service where I can hop on the phone or hop on, say, Zoom or Skype with people if they're interested in talking to me. I've done this like once or twice with people just for free, but I'm thinking of maybe offering that as a paid service if anyone's interested. If you are, go to my channel page, and then in like the About section, you should find an email address that you can reach me at, and you can send an inquiry through that. Also, what's running through my head recently is that I would find it very fulfilling, and maybe it would be very useful to others if I were to accompany them during the immediate recovery process of jaw surgery. What that might look like is, say, someone traveling out of state to a surgeon to get this procedure done, and you need someone there with you, not only to check you out of the hospital and say like help with travel or transportation, but I think I could even offer the services of like crashing in the same motel or hotel, bringing a blender, going grocery shopping while you're recovering and really just in bed for the first week, and assisting people with their meals, assisting them with the transportation, and also just mental, emotional support as best as I can as someone who has also gone through the procedure. So if you're interested in that, also reach out to my email, my YouTube email that you'll find on my page. Generally, I'm not at the spot where I want to do that right now, but if you're in a couple months, if your surgery's in a couple months, I am definitely open-minded to accepting work like that. And I mentioned earlier, I'm going to continue to document my journey. It might be less of weekly updates and more like monthly, just a heads up on that. And perhaps my uploads in between those updates will just be, say, short videos or shorts showcasing what I've learned or small little tips or whatever, you know. Part of the reason why I'm doing that is because I'm going to try and focus a little bit more on a podcast I have with my twin brother. You can find that link also on my channel page if you're interested in finding or seeing that we're not talking strictly about my jaw surgery or sleep apnea. It's just a way where my brother and I can catch up and see each other, crack a couple jokes maybe, and or invite friends on and all just kind of hang out. So if you're interested in that, we're having some success with that. And so I'm gonna pour more time in that in the near future. If I forgot to cover anything or give details more on how I'm doing right now, let me know. I'll definitely get back to you in the comment section. And I appreciate all the support up until this point, and I hope this was helpful. I will see you guys soon. Peace.